Welcome back to Let's Have Lunch, episode 31, and we are 2 days away from opening up. I'm pretty excited. I think our team is. I think everybody's just kind of getting spring fever, and anyway, so we're very excited. I want to make a few announcements just at the beginning here. If anybody has, you can go to our Facebook page, YouTube page. We put together this little kind of quirky video just on some of the things that we're doing that are important for your safety, making sure that there are masks and social distancing and the doors will be open, and we've got plenty of hand sanitizer and so forth and so on. So we welcome you back. We're very excited to have you back. We appreciate all your support over the last 6 weeks. Also, I just want to mention that the month of May, these ladies in Studio A have a special promotion, $9.99 per unit Botox, to celebrate Mother's Day and Memorial Day. You're welcome to schedule online or just give us a call. But today we have Hope Merz back, who's going to be our star today. Karen Whitney's going to be our supporting star today, I guess. I will say that. And Karen Lynch. I'm going to turn it over to Karen for a topic that happens to do with skin, acne, and acne scarring. And so, Karen, take it away.
Right, well, thank you. So acne is a frustrating skin disease from teenage years throughout adulthood. And one of our skin experts, Hope, is going to discuss why we get acne, how to treat various forms of acne, and also address the aftermath. Acne scarring can be devastating to skin and your self-confidence. So we're also going to go over the best options to improve acne scarring in today's Let's Have Lunch. So take it away.
All right. Hello, everybody. Yes, today we're going to go over acne, the few common types that we see day to day, and what treatment options we have, along with a little bit about acne scarring, because that's a common concern amongst many people. So first, I wanted to go over why we get acne. So I think it's very important to know why we get certain conditions so that we can better understand our treatment plan and be proactive in what we actually choose to do for our acne and scarring and anything else. So why we get acne, number one is clogging of the pore. So on this display, if you see, there is something called a pilosebaceous unit, or otherwise known commonly as a pore. In the pore, we have a hair follicle. You can see that sticking out there. We also have a sebaceous gland, which is responsible for secreting oil. So oil can clog in the pore along with other skin cells and different things that can create an acne. Another thing that can happen is we can get some bacteria into that pore. The bacteria actually contributes to making an inflammatory lesion, so those more pink and bumpy kind of lesions. The other thing that contributes is hormones, and we'll go over that a little bit further later on. But if you proceed to the next slide, we'll show a couple of the common types here. So first is comedomal acne. I know we all struggle here and there, at least once or twice, with some blackheads. So blackheads on the nose, right by the nose on the cheeks, commonly in this forehead area and on the chin. Also, so those are considered open comedones because there's actually an open pore with different skin cells and stuff clogged inside. There's a closed comedone, which is more like, you probably heard Wendy refer to them as milia, but closed comedones are clogged pores that don't have an opening. So we got to create some kind of opening for them to function properly. So comedomal acne, we typically treat with something that is keratolytic, so something that breaks up the different pores, the different stuff inside the pores. So over the counter, that would be something like salicylic acid. In the office, we would do something like a chemical peel. So a chemical peel is where Wendy, our esthetician, would rub a little bit of a chemical component solution on your skin, allow it to sit, and that's going to break up those outer skin layers a little bit and unclog the pores. She might do some microdermabrasion, some extractions, things like that, so that your pores can breathe. Maybe some dermaplaning to get off that skin, the top skin layer a little bit well too. The next type is called bacterial. So bacterial acne, it doesn't mean that you're not washing your face. It doesn't mean you're not doing your proper skincare. We all have bacteria called P. acnes on our skin. And some people just overproduce it. And it's not necessarily from, you know, sitting with your hand on your skin or not washing. It can also be from that, but not necessarily. So bacterial acne, very common in teenagers, very common in people that do sit like this, maybe staring at a computer screen or whatever. You're creating a little bit more bacterial growth on your skin. That is something we want to treat with over the counter. It would be something like a benzoyl peroxide. So that's antibacterial. There's a few different types of antibacterial washes. We can also do prescription topicals for something like that, where you put it on your skin daily and it helps fight that excess bacteria. Now, some people just overgrow it too much, and we need to do an oral antibiotic to help shut things down. That's not a long-term solution. Typically, oral antibiotics at a lower dosage are, for acne, are like a 3-month course, and then we try to wean you off of those. So that's a possibility. Chemical peels and things like that will also help that type of acne as well. Another common type that is also more stubborn and more frustrating is hormonal acne. This one can occur when you're a teenager, throughout your adult life, and it's very frustrating. It's also hard to treat without some type of an oral pill form in the more severe cases. But so on a woman, hormonal acne is typically on the what we call the beard area, the lower face, the chin, the upper neck. It is due to a higher androgen component. Androgens are a group of hormones like testosterone, progesterone, that kind of thing. And sometimes throughout our lives, we have higher androgen levels. So right before your period, your androgen level is increased. Also, with perimenopause, menopause, hormones are kind of out of whack. Stress initiates more androgen release. So those types of things we can always treat with either a pill that's going to take androgens out of our circulating system. It's a very mild pill called spironolactone. It doesn't have many side effects. We can do a low dose to a higher dose depending on the need. It's not always a long-term thing, but it can be. So that's an option. A good retin-A, so something that's going to get deep into the skin and really increase our cell turnover, where our dead cells are shedding off and we're creating new cells. That helps to keep our pores functioning well so that they're not going to get clogged as readily. So that's a great thing for hormonal acne as well as the chemical peels. So hormonal acne can be frustrating for many women and men. Men do also get this. So male hormonal acne typically shows up on the shoulders and the upper back. And, you know, we can't do as much orally like a spironolactone or a birth control for a man. So one option is something called Accutane, which is an oral vitamin A, oral isotretinoin. That's a 5 to 6 month course of medication that helps to shut down that type of acne in men. So,
And
yeah, go ahead, Dr. Mendelsohn.
yeah, no, I'm just curious. So, and I just want to slow things down for a second, just because this is, you know, this is such a complicated area. I mean, you make it sound kind of simple. The diagnosis obviously is critical to the treatment. Okay, number one, right? And some of the medications that you've mentioned, whether or not it's oral antibiotics or spironolactone, it sounds like those are temporary sorts of things that that patients will be on for a short period of time. So just if you could just kind of walk through the course, because by the time we see patients, right, they've been on, generally, they've been to their dermatologists and they've been treated for a number of years with either their home remedies or prescriptions. And patients have been on antibiotics for years when they walk in, you know, and whether or not it's their doxycyclines or minocyclines. So, I mean, maybe you could talk just a little bit about the approach to coming in, getting their history, diagnosing it, and then I guess what I'm saying is giving us a chance to sort of work with their skin so that ultimately we can solve their problem.
Okay, sure. So yeah, typically when we have consultations, a patient usually has tried a few different things, including being seen by a dermatologist and being on multiple different medications. So it really depends on the type of acne and the patient, but we do get a thorough history because we want to know, how long have you been on these antibiotics? Is it even bacterial acne that we're trying to treat at this point? So if someone comes in, they've been on antibiotics for years, typically I want to try to get them off if we can. And, you know, sometimes they haven't even considered doing something like a chemical peel or dermaplanes or topical regimen that could be simple and keep your skin balanced to where we can try to reduce off of those antibiotics a little bit. As far as the hormonal acne goes, birth control typically keeps people well controlled for, you know, years. And sometimes the spironolactone pills we only use, you know, sometimes people just take those the week prior to their period and they kind of know when to use them and when not to. I'll also do that with antibiotics. If you're having a flare-up, maybe 2 weeks on an antibiotic just to get that severe flare-up to be controlled, and then we can utilize other methods. Now, if someone struggles with bacterial acne on a regular basis, they may need to be on a topical like clindamycin solution or something every day for years until their skin kind of decides to stop producing so much bacteria. So it's really patient dependent, and you know, we do have to take skin types into consideration. Are you oily? Are you dry? Some people break out and they're dry, and then we have to take consideration to what they can tolerate to use on their skin. So I think an in-person consultation is usually really important, and especially once we start doing treatments on skin, we can usually tell more how it's able to respond and what we can and can't do with a certain person. So,
have you ever used azelaic acid? Well, I'm not asking for myself, I know you know, but tell me, I still, philosophically, I guess, because again, we have patients coming in, and depending if it's me that you've seen or if it's a dermatologist who's doing this all of the time, I'm not, Hope is, but I'm not. And, but I've had success, right? So I go to some basic things, but I'm just sort of curious then, because people have tried so many things, and so by the time they get here, again, there's so much frustration, right? So we're dealing with the acne, and I know in a moment you're going to go to acne scarring. You know, what do we do? We've got to control the acne before we can address the scarring, otherwise we're going to have a problem. But I guess just, so we get a history. How do you, you know, so I've been on all of these things, right? So I'm the patient. I've been on all these things. Oh my God, I've been on spironolactone. I've tried benzoyl peroxide. They put me on antibiotics. They forgot about me. I've tried. Nothing works, right? So what are you going to do that's going to be any different, Hope? You know, how are you going to help? How are you going to gain that patient's trust, and then move forward with an approach that over a period of time that you can be successful with?
that's a loaded question, Dr. Mendelson.
I know, but
well, I treated acne for years and years and years. I actually did my doctorate on a clinical trial with acne teenage patients. So, you know, I have a very large passion for acne. I know, and I've seen what it can do to the psyche and your self-confidence. So I take it very seriously. And, you know, sometimes we don't know the exact thing to use to treat acne, and you have to go through a lot of different medications. And I remember doing it in, you know, medical dermatology practice, that no matter how experienced I am, not every acne is the same. And everybody has a level of severity. And some people will be, you know, 2-3 pimples a month, and it's the only thing that they can think of. And it's the only thing that they put focus on. And then some others will be, you know, broken out, creating all this scarring, and it doesn't bother them. So it's very patient dependent. And when I talk with you, or when any of our members of our team talk with you, we can really get a feel of what your goals are. I want you to know what my goals are. Typically with acne, I mean, of course I want to shut down the active acne lesions, but also I want to prevent scarring. So no matter if you're 13 or, you know, you're 63 and you're breaking out in these hormonal lesions, I want to prevent those from creating lingering scars. Because even if acne doesn't bother you at one point in time, give it 10 years and you're seeing more and more of the scarring show up, it may bother you then, and then I haven't done my job. And I want to make sure that you're as confident as can be with your appearance. And acne happens on the face a lot. And, you know, we'll show you in a couple slides, it can be the first thing people see. And so I always make sure to have a study plan. My study actually involved acne teenagers with their compliance, because a lot of the times they're not compliant with their medications, and it's a little bit harder to get them into a routine with utilizing their meds. So compliance is a very, very big one. You have to make sure to use your medications, even if you're not breaking out. You got to get those topicals on. We have to keep it controlled and, you know, prevent the bad acne breakouts. But that's kind of my viewpoint on acne and the importance of treating it, not only now, but also for later, and making sure it stays controlled.
Okay, I think what I wanted to just draw out, so thank you, is I really, first of all, that you're an expert in this area, but even more importantly, this is tricky. You know, skin is tricky, and you know, not everything works the same. It's really rewarding, though, you know, when we're able to address the active acne and then move on to maintaining, you know, good healthy skin. So. So I guess what I would say is don't give up. A lot of times what I've done historically, I may just take the patients off of all of the medications that they're on. I mean, I'll put them back on something immediately, but it's kind of like they've been on these things and they aren't solving problems because the diagnosis is wrong and the treatment's not working. So, so anyway, okay, I'll let you get back on here, but I did have those questions.
Okay, no problem. So we went across or over all these different types of acne. What I want to show you is a remnants of after the acne lesions go away, what do we have left? So in this photo, you're going to see just a little bit of redness, maybe a touch of textural issues. That acne could be just a month old. It could be years old. So sometimes acne will leave redness in the skin, and that's just your skin trying to heal it, and then that blood kind of gets stuck there. So we can do different things to treat that discoloration. Also, you can notice a little bit of pigmentation. So your skin is also going to want to send melanin to these lesions and try to heal them. And so we've got redness, we've got pigmentation, and we've got a textural component. So we've got a textural issue on the top of the skin. So we can do, again, just a chemical peel will help with that discoloration a little bit. Maybe do a series of them once a month for 3 or 4 times and see how you are. Or if you want to be just a little bit more, not aggressive, but just a little bit more, get results a little faster, you might want to do some IPL treatment. So intense pulse light helps to pull out some of that redness. We can combine that with a cream that helps to get the brown out, that pigmentation. You also might want to think about some microneedling. So microneedling is a great place to start for mild acne textural scars. We use it for severe scars as well, but you can kind of adjust the treatment settings to be mild or a little bit more aggressive depending on the nature of the scarring and how deep it is. So for her, we could start her with a couple microneedles and just see how she does. Microneedling utilizes a pen that's about the size of a Sharpie. It's got these teeny tiny needles that go in and out really fast, and we can rub that on the skin. And those little tiny needles create these micro injuries that stimulate our skin to think that it's wounded. So it starts creating a cascade of healing factors. And so we start to build in a little bit more collagen, and our skin starts to raise, you know, these little divots start to raise up to where the rest of the skin surface is and create a smoother texture and tone. So that we use microneedling a lot, and I love it. I've used it for 10 years on my patients, and it really does help. It is something that you need multiple treatments. It does have a little bit of downtime, so you typically look a touch beat up for the first day. And the day after. Dr. Mendelson, if you progress to the next slide, I think I've got Mickey on there. Mickey is one of our nurses, and this is her. The first picture is a little dark, but that's a microneedling with PRP. So she's got actual blood product on her skin in that first photo where she's wearing a blue hat. PRP is platelet-rich plasma, so we can add PRP to any treatment. PRP is an additional source of our own natural growth factors that sends a boost of collagen-stimulating factors. So we draw your blood from your arm, just like a typical blood draw. We take that sample and we spin it in the back of our office in a centrifuge. That takes about 10 minutes to spin it down into the platelet-rich portion. That portion, your platelet-rich portion, is what's responsible, a big part of what's responsible for healing in our skin. So we can actually take that and we can put it wherever we want. So I like to inject it directly into the scarring, underneath the scarring. We microneedle it into the top of the scars. And that really helps with the collagen factor and the healing of these basically injuries on the skin. We also use PRP in other facets in the office. We do it for anti-aging. We do it to help with like around the under eyes and, you know, on the jawline, stuff like that, for tightening, for skin tightening. So PRP is a great thing to add. By day 3, really, your skin is mostly healed. So say you had a treatment on a Friday. By Monday, you should be able to go to work and not have anything that's uncover-upable, I would say. So you can see Mickey on day 2. That would be like if she had a treatment on Friday, you can see the middle picture the day after, that would be a Saturday, day 2 would be Sunday. So Monday, if she went into work, no one's gonna know that she had something done. But those first couple of days, you will have little scratches on the skin. So I do like for everyone to kind of prepare for that. But if we wanna look at some more severe scarring, I have a photo here that I just wanted to go over. So if you look at this woman, I mean, obviously a beautiful woman, great structure to her face, and the scarring stands out to me, and I want that to stand out less. So my goal with her would be to get her skin to the point where I'm not drawn directly to her scarring. Therefore, other people she interacts with shouldn't be as drawn to that scarring as maybe we are now. And then hopefully she'll feel more confident going out and about with her day-to-day life, her everyday activities. And there's no way that I can get her skin to be completely smooth like I would love to, but it's just not realistic. So what I would immediately, just looking at this, I haven't spoken with her, so I don't know her, you know, ideas on her acne scarring or what she would want to do as a goal. But just looking at that photo, I would consider microneedling or even something more aggressive like a dot laser. So dot laser utilizes heat. So heat triggers collagen very effectively. It also, when we use a dot laser, it kind of digs these little columns in the skin. Those columns slough off and heal in tighter. So you're kind of decreasing the size of the scar as well as building it up to make it more even with the healthy tissue next to it. So that would be probably in my treatment plan, at least 1, 2, maybe 3 dots in the next year or so for her to do. And then maybe some fillers. So injectable fillers are hyaluronic acid gel, and we can use them to temporarily plump up those scars. So that would give her an immediate improvement. She would leave the office within 30 minutes feeling more confident with a smoother skin tone and texture. And so that's a great option that I like to use as well. Anything that you would add to that, Dr. Mendelsohn, about maybe treatments for her?
Yeah, no, the only thing, punch grafts, potentially.
Yep.
A little minor surgical procedure where you take like a little, I explain it like as a little cookie cutter type, you know, so you've got a 1mm, 2 millimeter acne scar, and when those are deep into the reticular dermis, some of these other treatments don't work as well, and so we actually, imagine taking a little cookie cutter, kind of punching it out, now you've got a little hole there. Some people will suture it, they'll just use a stitch. We usually use a little tissue from behind the ear and just fill it in, and that works for more ice pick type scars is how we describe it. So, but yeah, that's that.
Okay. And so if you have any type of this scarring, please let me know. I will make a treatment plan for you and we'll customize it to whatever you want, what kind of downtime you have, what kind of improvement goal you're going for. The last thing I did want to go over is a type of scar called a keloid. So a lot of times these tend to form on areas of the skin that are under a lot of tension. So an area that doesn't have a lot of pull to it. So something like the shoulder or the upper back or the chest. This is a very common area to see these scars. So sometimes, you know, people that have a tendency for this will get acne lesions. The acne lesion goes away, and then the scar starts to overgrow. And when you have a hypertrophic or an overgrown scar that continues to grow and goes beyond where the initial wound was, we call that a keloid. And keloids are a more complex type of scar to treat because we want to make sure that whatever we do to correct that keloid or improve the appearance of that keloid, we don't create an inflammatory response to stimulate that keloid to come back. So we like to make sure we monitor that closely, meaning that if I do a treatment on some keloids, whether it's intralesional Kenalog, which is a type of steroid that helps break up that fibrous tissue, or if we excise the lesion, meaning that we cut out that keloid and stitch it closed, we're going to want to make sure that we follow you closely, maybe every 2 weeks at first, and then maybe every month, and then every 2 months, something to make sure that we're not growing more hypertrophic tissue so that you can be confident that your keloid's not going to come back, after a procedure. And so that's one that's very important because it does create a good cosmetic result after you resolve some keloids. So that's something that I also am very passionate about improving. So.
Yeah, and I think that there will be more additional information on hypertrophic scars and keloids, which is a very complex area. And Karen Whitney, wondering if you're still there. Hope that was excellent. Thank you for that.
Sure.
I'm wondering, with regards to fillers and scars, I mean, I know that you're seeing a lot of patients as well with scarring from a lot of reasons, including acne. Just curious how you feel about the treatment with fillers for some of these more moderate scars.
It actually is a very good treatment that can be really helpful. I have a few patients that, they're hitting late 30s and they're starting to have a little volume loss, especially in the lower face. And as the volume is diminished in that area, the scars become a little bit more prominent. So by actually filling the area as well as specifically addressing the depression of the scar, we can really give some nice smoothing and improvement. So it is helpful. And boy, I've learned, as I know you have, Hope, that something I wouldn't even notice right away on someone can just be devastating for patients. It's all they see when they look in the mirror. Not their beautiful face, not their eyes, not their lips. They see these few scars or this area of scarring. And it kind of breaks my heart, which I think it does yours as well, which is why you're so passionate about it. So yes, we're very happy to offer that treatment, and just recognizing that by overall volumizing and also treating the scar itself, we can make some improvement.
I think sometimes what I tell patients, and this could be about anything. I mean, acne and acne scarring is one of the main drivers, and generally, not always, but often it's a younger individual who's as impacted. It doesn't mean that younger individuals don't grow up to be older individuals who are still impacted, but excuse me, sometimes you're so focused on whatever that issue is, in this case we'll call it an acne scar, that I tell patients sometimes just to kind of take a step back, just to look at their face, because what happens is you're so targeted, it doesn't matter really what's done for that scar. We can't always remove a scar, we can never remove a scar, but we can improve the condition of the skin greatly. And so instead of, we're all our own worst critics. So of course, if, you can compliment somebody, Karen, your skin looks beautiful today. Next thing you know, you're like, yeah, but look I broke out. Look at the zit I have down here, right? I mean, that's what we all do. We all just kind of go towards that negative area. And so if you've had these problems for a while, obviously there's a big psychology to it. And I think part of improving the entire appearance, right, nicely, goes a long way in terms of taking the focus off just that one little tiny millimeter scar. So that's true. I know we've had conversations about fillers before for other reasons. It's the same sort of concept there, where sometimes we perseverate. We're so focused on an area that we just can't get it out of our minds. So, but Anyway, Hope, that was excellent. Karen, thank you very much. And do you guys have any other comments about acne or acne scarring? No? Okay.
Great job, Hope.
Good. All right. Well, we'll be back tomorrow. We're only 2 days away from getting open here. Come on in. We can't wait to see you. And Hope, thanks again. We'll talk to you guys later. Bye.